Joining us now, psychotherapist Dr. Robi Ludwig. Dr. Robi, thank you for being here.
Thanks for having me.
So I want to ask you about some of these numbers because they're striking. Researchers found that in 2022, about 7 million U.S. kids and teens were diagnosed with ADHD. That's a million more children than back in 2016. Do we know the reason for this increase?
Well, they think that more people are aware. So educators are aware, parents are aware, physicians are aware, and that can increase the numbers. Sometimes there are coexisting issues like depression, anxiety, and autism as well. They also expanded how it's defined, ADHD, and included more inattentive symptoms. So I think it's like a combination of all of these factors.
I have a question that might be a little delicate, which is, we have reported at NBC on the rise of parents actually seeking an ADHD diagnosis for their kids, mostly because then they can get extra time on tests, for example, the SAT, the ACT, when you're getting ready for college. So is that something that you worry about? Like, are there some of these cases where parents are really pushing for the diagnosis?
Well, still you have to go through a psychiatrist or a physician, and hopefully they would not give a false diagnosis. So it still has to be accurate. But I do think that there's no consensus. There's no diagnostic kind of universal way to test the ADHD, and that also can be contributing to some of the overdiagnosis, perhaps.
Well, to that end, what are the common symptoms, signs of ADHD? And are there any groups, demographics that maybe tend to get underdiagnosed?
So interesting. Well, first of all, if you're going to your doctor on a regular basis and you're in school, I think that that can really help in terms of getting the right diagnosis. Inattention, right? If you're not able to focus, you might be fidgety, talk a lot, make simple mistakes, not be aware of certain dangers. These are all, factors that contribute to ADHD.
And what treatments exist? I mean, I've actually been through this with my kids.
Oh, okay.
So what do you do?
So there's medication treatment, and a lot of it is stimulants, and they have non-stimulants as an option as well. It's really important to include behavioral and cognitive therapy as well. So behavioral therapy is looking at your behaviors, what works, what doesn't work, and also cognitive is your thoughts. What are your thoughts, and how can you bring yourself back to where you need to be?
And you mentioned medications. I'm mindful that for the last 2 years, there's been a lot of reporting around the fact that ADHD medications have been in short supply. The FDA saying the shortage has been resolved, but many patients are still struggling to get access to it. So are there alternatives?
There are alternatives that psychiatrists are using, and so that is a good thing, but it was a real problem for a while, especially after the pandemic. So hopefully that's being resolved. And also with behavioral therapy and cognitive therapy, all of those treatments can be helpful in getting a child on the right track.
Yeah, I think sometimes people think it has to be medication. It doesn't necessarily have to be all medication.
That's right. It should be a combination of whatever works. There are a lot of options out there.
Holistic approach to care. Dr. Robi Ludwig, thank you so much.
There's much more news ahead.
Don't go anywhere. You are watching NBC News Daily.